Zinc is a critical immunonutrient, and does it have a preventive and adjuvant treatment role in the treatment of COVID-19? That is what I am going to tell you all, and I firmly believe that it has. We know that lot of research has already gone right from the beginning that zinc has a role in respiratory tract infections, whether they are upper respiratory tract infections or lower respiratory tract infections. And COVID or coronavirus being a respiratory infection, zinc is a critical cofactor in the COVID-19 treatment. It emerged basically from China. So, what is the emergent evidence of zinc against COVID? We have a lot of supportive trials, which we know from a famous New York doctor who has used zinc and hydroxychloroquine and azithromycin in a synergistic mechanism. Then we also know from a mechanistic standpoint, there are a lot of anti-SARS-CoV-2 mechanisms of zinc. We also know that in the lung-induced inflammation, which is often seen with COVID cases, zinc might have a protective role. We also know that zinc boosts the antiviral immunity, and we know that if zinc is deficient and half of India is zinc deficient, it may be linked to mortality. So the first data of 100 mg zinc per day might be useful was when a study was published with standard therapy of hydroxychloroquine and azithromycin from New York. And we know very clearly the number of people discharged, number of people who needed ICU, number of people who needed invasive ventilation or died. There was a statistically significant difference in people who were treated with zinc had a better recovery. Clearly, we also know that the hydroxychloroquine, which is a popular drug which is used in prevention and treatment of COVID, particularly early disease, hydroxychloroquine increases zinc transport into the cells. And this is called as a zinc INO4. And it potentiates zinc-mediated antiviral mechanism. Also, there is a likelihood that there is a synergy between ivermectin, which also augments the zinc transporter ZIP2, and it increases the intracellular concentration of zinc. So there are a lot of protective mechanisms of zinc in COVID-19, including its antiviral impact and its potential to reduce fundamentally the ventilator-mediated lung injury, particularly in the comorbid population. It works very well in the comorbid population because we know that zinc improves the mucociliary clearance. We also know that zinc inhibits the pro-inflammatory cytokines and tries to mitigate the cytokine storm. Beyond that, zinc has very strong immunological actions. We know that zinc has a direct exertion of microbiocidal effect. It prevents the thymus from atrophy in children. It promotes cell-mediated immunity, and it corrects the Th1 and Th2 balance. So worldwide, there is a lot of optimism of zinc, and there are more than 19 clinical trials which are ongoing with zinc as an adjuvant therapy in US, in Australia, in Brazil, in Turkey, in United Kingdom and Egypt. So zinc now is a well-known adjuvant treatment for COVID because zinc helps direct antiviral activity. It modulates immunology. It has a possible protective effect of lung inflammation, ARDS, and it has an independent antiviral action. So zinc is actually useful in every patient which is likely to have COVID or a suspect COVID or a non-COVID flu. We also know that if you give zinc early, the antiviral dose improves clinical outcomes. And in absence of lab confirmation of COVID, it is apt to consider zinc as an immune therapy as an additional broad spectrum antiviral activity. So clearly, prophylaxis of asymptomatic people with contact with COVID patients is zinc is not going to be not only useful to boost up the immunity, innate and cellular, facilitate normal immune function in the innate system, stabilizing the cell membrane, inhibiting the entry of virus, inhibition viral replication, and so on and so forth. So obviously, it has some prophylactic role which has been hypothesized in SARS-CoV-2. So the most important thing is the right dose. Most clinical trials are saying at least you should use 75 milligram of zinc per day as an effective dose to prevent or treat viral infections. So zinc is a crucial micronutrient. And when you say that zinc is a crucial micronutrient, it is very imperative that you use it at the right time in the right dose. And in the overall, therapy of COVID-19, it has a very clear adjuvant place as a co-therapy amongst the various other immunological or antiviral therapies which are increasingly being used in the COVID 19. At the end of the day, we want to handle COVID well, we want to handle respiratory viruses well, we want to handle this pandemic better, and zinc is one such tool which, if used appropriately, can make a difference in the overall quality of life, in the morbidity and mortality and overall outcomes. Thank you.